Welcome back to the BrandProof podcast, interview style. I know this is a new setup and we haven't ever done this before, so we're trying to do a brand new type of show with our interview. And want to start off the show introducing Rachel Kaiser, who is with Baptist Hospital. What's your official title?
I'm the Senior Marketing Manager for Baptist Healthcare.
Senior Marketing Manager. Okay. And I got Lindsay here with me. And we're just going to try a brand new way of doing this show as opposed to our other podcast, which you can watch. But for now, what I want to do is kind of go into a little bit of your background.
Okay.
And why we've even got you on this show. And why Lindsay, why are you even friends with Lindsay? I mean, it's Lindsay.
It is Lindsay.
I mean, I have nothing but utmost respect for Rachel. The whole time. I do, really. Your whole marketing career, it's so interesting to watch how you started in the political arena and then you kind of stepped up into this position. So tell us a little bit about it.
Well, Lindsay, thank you. I highly respect you as well. I think we have watched each other grow up in this industry.
We have,
and it
for
has
sure.
been wonderful. It's been very fun to have somebody that you can use as a peer and a mentor. So thank you so much for having me. And so I actually started off moving down to Foley with my soon-to-be husband and getting a job at South Baldwin Chamber of Commerce as their events and programs director. And I was there for a couple of years. And that's really where I got my start in the arena of the community, government relations, all that stuff. And
in public relations, right? And that's when I was working as a marketing rep for a home health company. So I was volunteering with the local chamber so I could just meet more people in the area and kind of network and that sort of thing. So that's how we crossed paths originally.
Right. And so from there, you know, just being in that arena with government relations, it just opened up my door to meeting the staff for Joe Bonner. And there was the area rep for the area was being promoted to a new position up in Washington.
As a U.S. congressman.
Yes. And so I was invited on to be his representative for the area. There was two of us, one for one side of the district, another person for the other side of the district. And my sole purpose was to build those relationships for him, help maintain the relationships. And my favorite part, I think, was traveling with him to various events. And
I hate to age us, but this was kind of before the digital world came on the radar.
I mean, I want to say internet had probably been truly around for about 5 years. I mean,
it was more about public relations like actually one-on-one getting to know.
This is pre-Facebook. Post MySpace, let's say.
That's a good description.
Let's age it somewhere in there. And so I did work for the congressman for probably about 2 years. And then I was very much blessed in becoming a mother. And my husband farms and has a cattle ranch. And so both jobs were very time consuming. And time was not at that moment in time, it was just, I needed to put my child first. And so I had been talking with the CEO of South Baldwin Regional Medical Center. We were friends, and they were looking for a liaison, somebody that could just go out and basically do what I was doing, but in the healthcare.
Right, which is our local hospital that covered, I guess, I would say a 15-mile circular radius or 25.
25, just depends. And so I did do that. And what it was I was actually brought in to do that and assist in the marketing department. And so I was with South Baldwin for 5 years. I was promoted eventually up to director of marketing there. I was very, very, very blessed to have an amazing mentor when I worked at South Baldwin. She was brought in probably a year after I started working there, and she was the director of marketing, and she basically schooled me in what marketing is, what a brand is, what comes with the role, if that makes sense. And so I did that for 5 years, and then from there, I decided to...
And you did it beautifully.
Thank you, love. And so from there, I went to work for a compounding pharmacy. I just wanted to try something different, get into a new role. And so I did marketing for a compounding pharmacy for a couple of years. And that's a very cutthroat industry. It's one of those where you constantly have to be on your toes, constantly thinking of new concepts, because the purpose of it is to be able to fulfill a need that regular pharmaceuticals cannot fill. And so you're constantly moving, and you're constantly having to update and constantly having to promote. And eventually, the federal government came in. They did a lot of shutdowns on compounding pharmacies. And so I just knew it was time to move on to something else. And so I was very, very blessed to get my job at Baptist. It was one of those where I was like, okay, I'm gonna try this healthcare thing again. And I didn't know if I wanted to do it or not, but I stuck my toe in, and I just went in as a marketing specialist, just managing the marketing for a couple of clinics. And from there, just kind of went up the ranks a little bit. And so now I oversee the marketing for all the service lines for Baptist Healthcare, as well as all their clinics. And then I oversee the marketing for Andrews Institute. So it's a very rewarding and fun job. And it's one of those where I would not be there if it didn't have an amazing culture and it had amazing leaders. And that's what I think drives me to go to work every day. So.
And yeah, that's a beautiful story. And I do want to stop and pivot back to, we have a lot of small business owners that listen to this, that watch us on YouTube. And you mentioned when you were at the smaller pharmacy, you had to really think outside the box.
Yes.
And our latest episode was about that, right?
Right.
Yeah.
For the small business owner, once you establish what your brand is, how do you stand out in the crowd? So before we pivot to all of the amazing things that you do for Baptist Healthcare and the way you're able to resonate it in the local community for Baptist Healthcare for all the different product lines, I am curious, like if somebody was new to marketing and they were starting a small business, whether it's a small compound pharmacy or whatever it is, what is one bit of information or a tip that you would give them that you figured out in that setting that made you successful or made that company or brand successful? How did you make them stand out from the typical CVS, Walgreens of the world?
I think for any small business owner, I would say you need to have a mission statement. You need to have a very strong, precise, simple mission statement that tells you who you are and resonates as to what your purpose is. And as long as you have that,
that's your guide.
That's your guide.
That's your story.
That's your story. So and I hate to go back to Baptist, but Baptist has a very simple mission statement. It's helping people throughout life's journey.
And that's the same. I mean, it's parallel. It's this to this.
Right. And so as long as you hold, as long as you have a nice, strong statement there that you truly do believe in, I think that your brand can go far.
And does it go, like you said, you are over Andrews, which tell me what Andrews is.
Andrews Institute is orthopedics.
Okay.
So Dr. Andrews, who's from Birmingham, came down several years ago, and he partnered with Baptist Healthcare, and we formed Andrews Institute. So we have, hand and wrist specialists, we have spine specialists, we have total joint specialists. So
so they do different things than the other product lines or service lines that you're promoting, but the common thread is the mission statement.
The common thread is the mission statement. The common thread is our culture. So I think, it's funny that you mentioned that across two different brands, because it is perceived as two different brands. But I truly do think that when you're in Andrews, or if you're in the hospital or in the clinic, you still experience the same type of feeling. So, advice for a small owner is start small, strong, simple mission statement, and grow from there.
What I want to know, though, is say you do have multiple channels to market in, right? How do you know, if I'm a small business owner, how do you know where to market those? Because with all of the different social media channels, Facebook, Instagram, how would I know? Let's just say I'm a small business owner.
Right.
I'm personally on Facebook. Let's say that.
Okay.
That's all I know.
Okay.
Right? Past that, as a small business owner, I may not know what all the other social channels are. How would
are the digital places you could be?
Yeah.
Well, I think too, yes, if you know Facebook, you know Instagram, you can be successful in your marketing efforts. It's being consistent and concise and to the point and being repetitive. And I think if you need to know more than that, there are so many wonderful resources out there for you to utilize. And but
we have some people ask us, can we just do social media and not a website? What do you feel about that?
I truly feel like you need a cross brand. You got to cross promote. So, I mean, I look at it from a big world, unfortunately, but I think from a small business owner, I would say, whatever your messaging is, keep it concise, but it cross over. So definitely do web, definitely do social, definitely do podcasts, like something like this.
Yes.
Something that engages people and gets them involved and wants
Or
them
video, right?
right.
Which is what I say. I say everyone's got a cell phone. You could pick it up and do a little selfie video and just show people stuff. Show them your retail store.
And like she said, it's about the emotion. You want people to feel you and
or follow your journey.
Yeah, what makes your culture? What makes Baptist? No matter if the name Baptist is on the door or not, you want them to have that same feeling, and I think that's a beautiful way to do it for sure. Yeah. So,
but yeah, I do agree with video. I think that's a really good tactic to use, and I would think, we were actually exploring something with our mother-baby department, and it's really like just little snippet videos. We talked about like littles, like how to swaddle your baby.
Yes.
Because what happens is you put that, this is easy marketing tips right here, is let's say you do a video, how to swaddle your baby, right?
Right.
You put that on the web, you have increased your SEO substantially.
Exponentially.
Yeah, right.
And that's free.
Right.
That's free.
Totally free.
And people actually see value in it. Yeah.
So if you want to be a key driver, then it's always good to change your content. It's always good to upload relevant information
that people find value in.
Your
target audience.
And when you say change your content, do you mean on social, on web, on both?
Both. I would say both. I mean, definitely on the web. So whether you promote social, Instagram, if you promote via digital marketing or whatever it might be, you're always leading somebody back to your website. You're always wanting somebody to come back and have that touch point. And so I would say definitely changing up your content is very important, not only for the consumer, but it's also very important for Google to keep it on the back end. And you're always, Google will find you more valuable to them and to the search people that search by your content change.
Right.
So.
Right. And on a past episode of BrandProof podcast, we have actually talked about this.
We have.
Where my example was, what I would tell my clients is imagine your website is a living, breathing entity. If it wasn't, if all the items were always the same all the time, when your customer went there throughout time, they wouldn't shop there much.
It's like your storefront. You're going to change the window.
Yeah, your storefront of your building.
You're
going
to sell things and get new merchandise.
Or what if you go even further? What if you go into the store and the clothes are always the same from months to years to?
But I already bought the clothes. Like, what am I going to do?
What am I going to do now? It's the same with a website.
Right.
Would you agree?
Yes, I do agree. But the question is too, is like for the small business owner, like when do they have the time to do it? If they're, and so I would say make actionable items, something that baby steps.
Exactly.
Right.
And start with, and this is what also we talked, I think it was the same episode, how they may buy all of these beautiful digital Google ads, but their website is non-existent, or it just looks like a cookie cutter, I don't know, stock image, like a just sad place,
right.
And so if they build a nice, strong foundation, and it doesn't have to be expensive.
Right.
They may not have the budget that you have in your current position, But if they start with something that's solid, on brand, and actually relevant, then it's easy to go in and make those little updates. But don't overwhelm themselves that they have to do everything all the time, every day.
Take baby steps is my opinion, and because, I mean, in this world, anymore, especially like if I'm given a new project or something like that, I'm like, oh my God.
Yes, I know.
Oh my gosh.
Right.
How am I going to make all this work? And I think once you start breaking it down into little areas and
make it tangible, right? Like maybe update your website once a month, but post once a week.
Right, exactly. And, and it sounds silly, but put it on a calendar.
Right.
Change, make it part of your daily routine or weekly routine. Or
you're going to go in and you're going to sweep. You're going to go in and merchandise. You're going to go in and invoice and bill and So just have a little marketing snippet right there on your calendar.
Or just create a social media calendar, which is what a lot of
people,
they have free ones.
They do have free ones.
Yes, they do. They do. Yeah. So, Rachel, I want to circle back and hone in on, and I would say successes, but really failures, if you want to go there. While you've been at Baptist in this role, or even in your previous roles, that small businesses could really learn from?
Okay. Well, one of my first, there's been several things that I'm very proud of that I've done over the years. And I find a lot of joy in projects and seeing them go through to fruition. And so I would say early on when my favorite accomplishments was the Healthy Women program at South Baldwin. That was a women's empowerment program for individuals 35 plus. And the whole basis and the concept of Healthy Woman was because women are the major decision makers within the household. So, case in point, I make my husband's doctor's appointments.
So you would choose whether they went to South Baldwin Regional or another hospital in the area.
Yeah. And so this program was really based on women's empowerment and bringing them in and letting them know that they do have some type of voice. They have the ability to pick who their provider is, and they would learn things along the way. And we had really great events and programs, women's conferences. 5Ks, yes. And so that was a really big accomplishment for me as an individual, I would say. And I did it with a group of amazing ladies. I had a women's board. You were part of that.
I was.
And we all would rally together, and it was just a fun. It was so fun.
Ryan, she is being very, I don't know what the word is. I don't think you're being as grandiose as you should be. She literally determined their target audience in our local community. And when I say 35 plus, I mean 30s, 40s, 50s,
everybody
60s,
enjoyed.
70s. And all of a sudden, they were all united in our local community. And we would have, or she would have, consistent speakers. Monthly, quarterly.
Monthly speakers. And then
a conference that you would bring in national speakers.
Yes.
And then we would get pink tutus, and we would have the 5Ks. And it was just
a Diva Dash. And it was fun.
All of a sudden, all these women felt relationships,
and it was a very strong bond, and
with the hospital too.
With the hospital,
they became your advocates.
They did become advocates for the hospital.
They did.
And then I would say with Baptist, my greatest accomplishment is we have a very robust team underneath us. We have web developers, writers, editors. We have community event coordinator. We have a digital marketing manager.
So not as grassroots.
Not as grassroots, but it is grassroots. We do have a community wellness program.
Okay.
So every aspect of it, I had never worked in an environment like this before. It was, I was always a one-man band, if that makes sense.
Absolutely.
And so it was very interesting going into this role and having to kind of give up ownership a little bit of some stuff that I was used to doing. And really relying on other team members to fulfill it and do it way better than I ever could.
Like the small business owner that may say, okay, the person that's working my retail counter could really help me with the social media.
Exactly. Yeah.
So, yeah.
And so, And so I would say when we built our new hospital 3 years ago, we opened up almost 3 years. And while we are in the process of planning this new hospital, there was a wonderful idea to rebrand the hospital, to rebrand the entire thing from mission statement all the way across the board. And my role in that is because I love project management. I love a good project, that I facilitated the organization of the rebrand. And I must say, to watch an amazing facility come into fruition through leadership, and then to watch the team come through, and we had videos and podcasts and all that stuff going on leading up to.
So you brought everybody into the reinvention and the transition.
Yes, via my leader, because I could not have, but I was responsible for coordinating service lines, making sure every little I was dotted, every little T was crossed, every little appointment card had the right address, the right phone number. And to think about that, that is huge.
Yeah, it is.
That is a huge undertaking for how large the hospital is. And then in turn, change a logo, change a look, a style.
Right.
That was a huge accomplishment. Not just for me, but for I think everybody on our team. And I think all of us will say that it was that time in the build of the hospital was probably the busiest time of my entire life.
And I would say, changing a logo sounds easy.
It does.
Like,
it's
let's
not.
just change a logo. That does sound easy. But how many different things is that logo on that you have to change?
Email signatures and
or
business cards.
everything related to that logo.
Right.
Well, and the thing is too, is like with a brand and with a logo, there's ownership and there's love, or maybe not love, but
attachment.
And, and it's the community's perspective of you. And so it's like, you have to, we still embraced part of it. Like some of it still stayed with us, but then we just kind of modernized it a little bit.
Right. In your story. It's all about storytelling.
Yes. And so, it was fun. It was, I would say, probably one of my greatest accomplishments.
Absolutely.
Yeah.
Yes.
One of the words that I've heard you guys mention quite a few times is community, right? So small business owner, again, how important is community for let's say I'm a new business. I'm just starting up.
I think I have something for you.
Yeah,
I'm already thinking.
let's go into that a little bit, because I have seen a lot of businesses. They just kind of stick to themselves. They show their specials.
Put yourself out there. Lindsay and I have a good friend who owned Home Care Companions. It was when we were talking about it earlier today.
We were.
And Sue is one of those. She was one of my first volunteers at South Baldwin. She would come and help me get the newsletter put in the mail, or she'd show up at a health fair with me
while she was starting a
very
teeny
small business.
Yeah.
But she attached herself
to the community.
And through that, she built a very successful business. But she did it, I truly feel like she did it the right way. She grew healthy. She stayed the course. And she built a
strong relationship,
not just with the hospital, but, that's another thing is when you look at what your feeders are, you need to look at your feeder patterns. What is feeding your business? And that's what, it's just like a plant. You fertilize it, you tend to it. And that's,
Yeah, because in this case, think about it. She got active in the chamber. She got active with the local hospital. Right. So, of course, the hospital will be sending her referrals. But who am I? Like, I'm in the local community, right? But I know people that our ages of our parents need that sort of help, whether they just had hip replacement, knee replacement, whatever. So the word of mouth, those public relations and those interpersonal relationships she built were so valuable in all of that.
True.
So.
And that's just going back to my chamber roots.
Yeah.
Is get involved.
Yeah.
Get your name out there. Join networking events. I don't know if they still do that in the area or not. If they have
They do. I think for the small business owner, in general, it's hard to be everywhere all at once. But I go back to what you and I were talking about. Just take it off a little bit at a time.
Yes.
And for me, getting active in our local community, I had so much, so many physicians I had to meet, so many places I had to like get my foot in the door. So for me, I said, okay, I'm not very comfortable just showing up at a business after hours or a breakfast with the local leaders, or the leadership luncheons. So I volunteered as a diplomat. Remember that?
Yes.
And then I had to be at like one event a month, and I had a name tag.
But it's good because, like, I mean,
tag.
I truly grew into I was more introverted before I moved here.
Right.
But I grew into an extrovert. So people will tell you they'll see me during the week, but they don't see me on the weekends. It's because I'm at home resting.
Right.
But I tell you, get out there, get involved, and if you are uncomfortable, volunteer, because when you volunteer,
you have to be there and you have a purpose.
To be there and you have a job.
Right.
You're not just having to wander around a room looking for somebody to talk to or standing up against a wall.
Right.
You're sitting there collecting tickets, or you're serving a drink, or you're doing something, and you're interacting, and it gets that anxiety out of you a little bit.
Absolutely.
And
the business owner that doesn't have the time to volunteer, go to your neighbor and say, hey, are you a member of the chamber? Can I come with you?
Right.
And meet just a person or two each time, and it grows. So.
Yes. And we do have another friend in the community that's a small business owner. She has a boutique, and she's very good at empowering her friends as ambassadors.
Mm-hmm.
She does a very, very good
They want to
job.
help her.
They want to help her. She's a good friend, and she empowers you to help her. It's the craziest
It
thing.
is. Like, you want your husband to use her for a tux rental, or you want to leave her a Google review because she asks you. And did you know, this is a fun fact.
Oh, good. I like fun facts.
What percentage of people, if you ask them to leave you a review, will actually leave the review?
Ooh, I don't know. Do you know?
If you have the answer, I would love to know.
2%?
98%.
If you ask them.
If you ask them?
That's the key. That's the key.
That's very interesting to know, because we are starting to launch a Google review campaign for our locations.
Yes.
Strategically.
You got to make it
But
easy.
is that
you
in
got to
person?
give them the link.
That's not a generic, I'm going to throw this out here. Hey, leave
No,
us a review.
that helps. Social media, please leave us a review. Probably 28%.
But if you're
no.
personally asked by somebody,
Right.
So like, for example, in our clinics, we have Google review sheets, and we give them to our doctors, and it's up to them if they want to use it or they don't want to use it.
But if that nurse or that doctor says,
and our neurosurgeons are my poster children to this, because their star reviews are phenomenal. And it's because they have empowered themselves to say, please leave me a review.
Right.
Thank you so much. Please leave me a review. But you have to be forefront. You have to put yourself out there and ask for it.
when that patient says, thank you so much for doing this for me and my family, this is my job. This is what I love to do. But if you don't mind, do you mind filling out that survey or that text, clicking on it?
Case in point, when my daughter had to have shoulder surgery, I was referred to a surgeon over in Mobile. I was like, okay, let me see who this guy is. Well, I go, and he has 5 stars, and I'm reading all of his reviews. Well, of course, I'm going to take my child there.
Right.
That's who is going to take care of my kid. But if I went to that and I saw
3.9,
3.9 or 4.2.
Right.
Yeah, 4.5 is my threshold. What's yours, Ryan?
It depends, but if I know them or not. But yeah, 4.5 is pretty much.
Yeah.
Or maybe 4.3 if I'm really
It depends on the industry. Restaurant-wise, I'll give a little leeway. Medically, I will not.
No, medical, the higher the better.
The higher the better.
Yeah.
Which is interesting that we're saying this about Google reviews, because I have noticed over the years, and I'm sure you guys have too, is that not all businesses have a Google business page. They don't.
Or they have one that Google
has developed for them.
Right.
That's kind of an interesting kind of side
Well, and I
note.
think it's very important for you to, if you do have one, claim it.
Right.
Yeah.
And that is your best calling card, and you've got to
Absolutely.
You have to monitor it,
And if you don't have one, make it.
And then thank everybody. Thank them
Yes.
on Google for leaving the review. It sounds like a lot of work, but I mean, we have a team that's they're dedicated to responding to every positive and trying to fix every negative.
But if you don't have a team, just a simple thumbs
thank
up
you.
and thank you.
Yeah.
That's all you need to do.
Right.
Yeah. I could go on and on about Google business pages, but I feel like it's a hybrid. It's not your website, which is your storefront. It's not your social media, which is your relationship building. It is that hybrid between the two that links everything together. And I really think Google, hit the gold mine when they created Google.
It's a double-edged sword, but it's a good thing to have.
And it's free.
Yes.
Yes.
Yeah, it is true, because if you do get a lot of negative reviews and you don't respond to those,
It's going to be your demise.
it's the end.
Yeah.
But you're probably going to have an existence out there. You need to monitor it.
Right.
know?
Just do a simple search.
Yes.
Yes.
Exactly.
Right.
So,
Well, and I think it's just very easy by just, if you're a small business owner, have a QR code sitting there on the counter that says, please leave us a review.
yep.
Make it part of your script when you're talking.
And when you
to
get the good reviews, put it on your social media. That is such easy content.
oh my, yeah.
You know?
Yes.
Yeah.
Yes, we currently do that right now on positive reviews. We
Right.
highlight our providers that way.
And so then
Patient
people, all of a
testimonials.
sudden, you're not bragging about yourself because you're telling them what other people feel about you.
Right.
And then at the end, hopefully, you put the little link. Like,
Right.
do you have a positive experience with Baptist Healthcare?
Yes.
Leave us a review. So
Well, this has been a fantastic interview.
it has.
Yeah. Thank you so much for
Oh, thank y'all for having me. I really do
coming and
appreciate
joining
it.
on our very first BrandProof podcast interview.
Yes.
Yep.
I think we've kind of learned a lot here too.
Oh, absolutely.
I've learned a lot.
Yeah.
sitting
Is
here.
there anything else you wanted to share with us today? Or we've covered the gamut.
I'm very excited about this podcast, and I'm looking forward to following it and watching future podcasts. I feel like this is going to be a huge benefit for the community. And talking about brand, I do want to leave with have a good mission statement, have a good culture, have good people, and you will succeed.
Absolutely.
I love
Yes.
that.
I
I
do
love that
too.
a lot.
I do too.
All right, for you guys at home, if you would like to subscribe or comment or give a little like to us, we would certainly appreciate it for sure.
Or any ideas for future interviews?
That would just leave a comment down below.
That
I'm
would
sure
be
she
great.
reads everything.
I do. And I better respond after today's interview, right?
That's right. But in the meantime, what do we always say when we close out?
Stay bold
Stay you.
and get branded.
See you next time.